I'd like to thank the Planning Committee for the opportunity to present this morning. And my name is Richard Lamphier. I'm the lead instructor for the Georgia Nurses Association Resuscitation Center. And today I'm going to present on heart-safe communities. I do have a couple of disclosures. I'm the lead instructor for the Georgia Nurses Association, and I'm also an instructor trainer for the American Red Cross, and I do provide CPR first aid training. Today's objectives is we want to learn the signs and symptoms of cardiac arrest, learn the primary prevention of cardiac arrest, learn secondary prevention of cardiac arrest, and then talk about the chain of survival. First, the chain of survival, just a quick refresher. Early recognition, and this is from the American Heart Association, early recognition and call 911. So what does a cardiac arrest look like? Second is CPR, quick CPR, early defibrillation with an automated external defibrillator or an AED, and then effective advanced care. And then we want coordinated care in the hospital. So make sure that the patient goes to the right hospital for the right type of care. So let's talk a little bit about primary prevention. And there's some key warning signs, especially in pediatric patients and also in young adults, that could lead to sudden cardiac arrest. I just want to clarify, there's a sudden cardiac arrest is different from a heart attack. A heart attack, we'd like to say that that's a plumbing problem, so the coronary arteries get occluded and prevent the blood flow going to the heart tissue. That can cause a cardiac arrest, but a sudden cardiac arrest is more an electrical disturbance in the electrical pathways of the heart, which causes a sudden collapse, usually without warning signs. A heart attack usually has some type of warning signs, and we'll talk a little bit about that. So key warning signs is exercise, emotion, startle, seizure, syncope. So when people are exercising, they could have symptoms, usually head symptoms, they feel dizzy, faint, or they can suddenly collapse. And then exercise, chest to shoulder pain or shortness of breath. And when I'm talking to coaches, I always like to explain, when you see a running back or a wide receiver running with the offensive or defensive lineman, it may not be that they're slacking, their heart rate could be elevated because of a heart condition. And so when they try to kick it into second gear, they're not able to. So that may be why they're getting shorter breath or they're complaining about chest pain. It's not because they're out of shape. It could be a cardiac condition. So I always like to remind them to think about that, just not to dismiss it. And then sudden, unexpected, unexplained death before the age of 50 years old of natural causes. We don't think there's anyone should pass away before the age of 50 of natural causes. So really think about your family history. So any cousins, uncles, grandparents that passed away before the age of 50, say from a single car accident that wasn't related to drug, alcoholism, or falling asleep, they may have went into cardiac arrest before they ran off the road, and that's what caused the car accident. And also think about any drowning victims. There's some cardiac conditions when people jump into water, their heart can go into irregular rhythm, and that can cause the drowning. Their heart stopped, and that's they proceeded to drown. So sometimes they'll be listed as a drowning when really it could have been their heart condition. And those are genetic conditions that can be passed along to other family members. So think about those and think about that in your family history. And really know your family history. Does anybody in your family have any problems with their aorta or cardiomyopathy or channelopathies? And I always think about my sister who called me about 7 years ago and said that she needed to have heart surgery. And I said, "Oh, really, sis, what for?" And she told me that she had this thing, it's called bicuspid aortic valves. Usually in the general population, someone who has bicuspid aortic valves is about 1% to 2%, unless your sister or brother or family member has that, then the percentages of you having that, of me having that, goes up to about 28 to 29%. And I said, "How long have you known about this bicuspid aortic valve?" And she goes, "Oh, about 8 or 10 years. And I thought to myself, well, that'd be good information to share with your siblings. So after I hung up the phone with her, my next call was to the cardiologist to get tested to see if I had bicuspid aortic valve. I did not, but that's one of those things that I'd like to share with people, is that you really need to know your family's history. And then another thing to think about, when are children getting their ECG screenings? So we can do a simple EKG test, their primary care, talk to your primary care providers about this, if this is something that your child should have. And there's some organizations that would do mass ECG screenings at local schools and other centers. So you may want to be on the lookout for those, and really talk to your primary care physician about ECG screenings and pre-participation physicals, and also really talk about and dive deep into your family history, because those are some of the things that can put children at risk. They're very rare conditions, but they do happen. So it's really important that we can prevent them from a primary perspective before it happens. Next, I want to talk about secondary prevention. So what do we do if somebody has a cardiac arrest? This is really what we want to talk about, and this is how we can help keep our community's heart safe. And so what do we do when this happens? This is a basketball player by the name of Hank Gathers. He went into cardiac arrest during the NCAA tournament. And when he did, there were some things that didn't happen. One, they thought he was having a seizure, so CPR wasn't started immediately, and there wasn't an AED placed until he got to the ambulance. At the time, this was back in the 90s, and at the time, there's a famous incident or a picture of this in Sports Illustrated. The team doctor actually had the AED in his hand, walking next to Hank as he was being taken out to the ambulance. So there was an AED there, but it wasn't placed until he got to the ambulance. So we really want to emphasize CPR. So anybody can do it. We all have the tools. We have our hands that we can press hard and fast in the middle of the chest. And one of the things that we know, there's about 4 reasons why people won't do CPR. One is, I'm going to hurt somebody. You can't hurt them no worse than where they're at. People think they're breaking ribs when they're doing compressions, but really what you're doing, it's like your knuckles cracking. And so that sound, when you push down in the chest, because of where the rib cage is set up, it pops and it feels like that, especially if you're the first person to start doing compressions. So don't be worried about that. The other thing is, I'm going to do it wrong. People think they're going to do it wrong. You won't do it wrong. The only thing you do wrong is if you don't respond. And then people think they're going to be sued. We're all protected by the Good Samaritan Act. So, you're protected by that as long as you're doing what you've been taught to do, or doing it to the best of your ability. And now with telephone CPR that was passed during the Georgia legislation, that 911 operators will help coach you through doing CPR. So don't be afraid. You're not going to hurt anybody. You're going to do it right, and you're going to be protected by the Good Samaritan law. So then I want to talk a little about automated external defibrillators, AED. And this is the third link in the chain of survival. So I want you to think about, in your facility, so your place of work, your place of worship, any gyms that you frequent, any community centers, your children's schools, your children's athletic leagues, but more, and also your children's practice facilities. I always think about going up to Gwinnett, to one of the football centers, and they have this beautiful football field, spent millions of dollars on this football field. And I was talking to the director of football operations, and I kind of knew the answers to these questions. So I asked him, do you have an AED? He said, yeah, we have one right here in the concession stand. I said, we play football on Saturday mornings. We start at 8 o'clock. We play into the dark because we have lights on. I said, that's great. And this beautifully manicured field. And I said, well, how about CPR and AED? He said, well, we have an ambulance here for football games. We have parents that are doctors and nurses. They know how to do CPR. I said, those are, that's great. And then the next question I knew the answer to, because I said, now, where do you practice? I knew they weren't practicing on this beautiful field. He said, well, you go down the road, you turn left, and we practice at the old soccer fields. And I said, where's the nearest AED there? And he said, at the concession stand. Practice fields are probably a quarter mile away, maybe a half mile away. So I asked him, I said, how many knee surgeries have you had since you played at Georgia and played in the NFL? And he said 3 or 4. And he said, I understand. He said, we need to have an AED closer to the practice fields, or we need to have that portable AED that we can take with us. So it's so important. We assume that these things are in place, but when you think about coaches that are coaching our rec leagues and our little league players, they're really the parents that are able to get off work at 5 o'clock, get dinner made, get the children fed, and then get to practice by 6 p.m. They don't necessarily think about what can happen in these medical emergencies, and especially a cardiac emergency. So it's really important to make sure that your children are practicing and playing someplace that's prepared to respond in a cardiac emergency or really any medical emergency. These are things that you can use for any medical emergency. If somebody has a seizure, somebody breaks their extremity, breaks an arm or breaks a leg, gets a concussion or a head injury. So these are things that you can put into place that will really help in any medical emergency. So this is what an AED looks like, and it's going to deliver a shock. It's real simple, but a lot of times people think this is what's going to happen. It's not going to be like that. It's not like in the movies where they jump off the bed, 3 feet. It's going to deliver a shock, and it's going to convert the heart back into a normal heart rhythm, as long as we get there quick enough. And that's so important. Early intervention is so important. This is what it looks like when we open it up. This is what some people think it's going to look like when they open it up. So I don't want you to be afraid of using an AED. You do not have to be medically trained to use an AED. All you have to do is turn it on and follow the prompts. It's going to tell you to place the pads. It's going to tell you to clear the patient, make sure everybody's clear. It's going to tell you to press the shock button if a shock is advised. So some AEDs will automatically give the shock, will deliver the shock, will say shocking in 5, 4, 3, 2, 1, shocking, everybody clear. And then one thing I want you to know that if you turn an AED on, if the power's up, it can deliver a shock, even if it says low battery, it can still deliver that shock. So still use it to the best of your ability and to the best of what that AED is capable of doing. So it still has a couple shocks, even when it says the battery is low. But this is what we'll talk about next. This is part of the emergency action plan. Who's checking the AEDs? Who's making sure the batteries are replaced? Who's making sure the pads are replaced when they expire? There's about a 2 to 4 year shelf life before these things expire. So we really want somebody to be the champion to be able to follow that. But this is, it's so important to deliver the shock as soon as possible, because early defibrillation, for each minute that passes, survival rates drop by about 10%. So it's so important. Put the pads on. It's not going to shock anybody who doesn't need it, but it will save a life to the person who does need a shock. So important to put the pads on immediately and listen to what the AED tells you to do, what the prompts say. So let's talk about the EAP, the Emergency Action Plan. So this is really where everything comes together. CPR training comes together. The AEDs, you have one in your building, you have one in your car, you have one at the practice field. So now how are we going to put these? We know they're great to have, but without a plan, they're just sitting on the wall, or somebody else knows CPR. So it's real important to have a plan, have a plan in place. And some of the things to think about is, one, what equipment do you have? So do you have an AED? After this presentation, I want you to check in work, church, or place of worship, schools, athletic leagues, the swimming pool, the community center. Is there an AED there? How many are there? Can you get to it? Is it locked up in the coach's office or the athletic director's office or the Is it locked up in the school nurse's office, or is it locked up in security? Is it accessible? And then make sure there's a budget for replacement pads and batteries. And then think about the buildings. What's the building name? You may remember it as, the old Coca-Cola plant, but now it's been changed, or the old church, the Methodist church that is now a new building, or you may know, you can tell 911, what's the address of where you're at? So important. And then, do you have access? Can you get into the building from outside? Do you want to make sure that you have somebody that has access to that AED? Like this scenario I talked about, the AED being at the concession stand during practice. Is somebody there with a key to be able to get into the concession stand, because they're usually closed during practice? They're available for game days, but who has a key to be able to get to the AED if you need it? And then, are there elevators or stairs? I remember going to the Coca-Cola building and talking to some of their executives about having a heart-safe building. And we looked around I think we're on the 23rd or 24th floor, and we looked for an AED. There wasn't one there. The nearest AED was at the entrance on the first floor. So how long is it going to take security to get from the first floor to the victim up on the 23rd or higher floor? Where are the AEDs at in your building? I know they have emergency bypass keys that they can take the elevator directly up to the floor if they need to. But think about the time that has passed. You just saw that illustration of survival rates in the time of shock is being delivered. So one, you have to recognize a cardiac arrest. And when it happens, you're going to have that initial pause. That, is this really happening to me? Two, you're going to have to start CPR. You're going to have to call 911. You're going to have to activate. You're going to have to call security and get them there. They're going to have to get the AED. And so all these things are seconds that are delaying time to shock. So important. And then think about EMS access points. Is there any construction between you and the nearest ambulance or nearest fire station? So think about that. When you go to work, I went past a road the other day, it was completely closed. So if I needed 911, I'd have to tell them that that road's closed. You're going to have to go around and come back to the back of the building. And then, are there any locked gates? Can they get through security? Can EMS get through security? Can they get into any practice fields or football fields or anywhere that you're at? Kickball leagues, softball leagues. What's the nearest place for that ambulance to get to the victim? Are the gates locked? Can you get them in the back door? And I always, think about soccer Saturday or football Friday when we have soccer games in Little League. A parent goes down or a grandparent has a heart attack and goes into cardiac arrest. If you've been to a soccer game on a Saturday, parking spots are at a premium. How is EMS going to get through that parking lot? Is it better to get them around back to where they can get through a gate to the victim? Or are you going to fly somebody out? Where's the helicopter landing pad? I know that's designated usually by the 911. When they get there, EMS gets there, or police or fire gets there, they'll find a landing zone. But think about these things as you're planning these venue-specific emergency action plans. I just want to show you this is the PepsiCo plant in Warner Robins, Georgia. About 5 years ago, they called us and said that they wanted to have some CPR instructors there. They wanted 6 people to have CPR instructors. This is the main entrance to the plant. And actually, it's bigger now. I believe this field has been expanded into more of the plant. I think it's about a mile square, but this is the entrance to the plant. You can see the parking lot. So most people would put an AED here, but how are you going to get that AED to this back section? So how many AEDs do you have? Here you can see the trucks back here. How many AEDs do you need to cover this area? And we say we want the shock off in under 3 minutes. So if you need somebody to take the AED from the front entrance to that back parking lot, it's going to take more than 3 minutes to get the first shock off after somebody collapses. So where do you want to strategically place your AEDs? How are you going to get them to the victim as soon as possible? And so it's so important to really do a site assessment and see where the AEDs need to be. You can cheat a little bit. If you have a couple AEDs, maybe put one here. It covers this building and then it covers this building, or maybe one over on this side or in this building. So it covers these areas that you can get a shock off in under 3 minutes. And then the other thing I want to talk about is, how about remote? What are you doing when you're having Zoom meetings? Just for example, this meeting, what happens if somebody has a medical emergency during a Zoom meeting? What do you do then? Are you thinking about that? Whether it's school, whether it's work, or whether it's your family members that you're Zooming with. What happens if somebody goes, if you see somebody slumped over at their desk or they grab their chest and suddenly collapse? What are we going to do? How are we going to get to that person? So are you talking to your staff about online emergencies? And then how do you know where that participant's location? Are they at home? Are they in a pod? Are they in the office next door to you? Do you know where they're at? So it's so important to know the location. Do you know that location's address? How are you going to call 911 and say, hey, my coworker is at, 123 Main Street. It looks like they're having a medical emergency. Can you go there? Is there another family member there that you can call and say, hey, go check on them, because they may be in the office, spouse may be downstairs working in another office. They don't even, they don't hear each other. So is there a plan in place to be able to contact somebody to check on that person? So important to have the plan in place before you have to use the plan. I always say it's too late to Google it. You don't have time when a medical emergency happens. And what steps have you implemented for online medical emergencies? Can they call somebody? Do they have that number that they can call? Have you talked to them about a medical emergency at home, to where who's going to meet 911? Have the front door open so 911 or unlocked, so when fire or police get there, they can come in. What are you going to do with pets and dogs? Do you have a dog? Do you need to put them outside? Do you need to put them in the bathroom so it's safe for the medical people to come in, or the police officers to come into your house? So these are some of the things that you really need to think about. And I hope and pray you never have to use them. But if you are ever in a situation where there's a medical emergency, I want you to be able to have a plan in place to be able to do that. So how do you communicate a medical emergency? What's your communication plan? So we have this person at work recognizes a coworker that collapses, or you see them collapse when they're online. How do you recognize that and get 911 there as soon as possible? So do you have a cell phone? Do you have a landline? If you call from a landline, they know that the address is going to show up on the 911 operator's side. So how do you get that ambulance to that victim as soon as possible? And then do you have an internal emergency response team? Do you know what to say? My coworkers collapse, they're diabetic, what do I do? And then, can we get 911 there as soon as possible, or your internal emergency response team there as soon as possible? So think about that. What do the emergency responders need to bring with them? So that's why it's so important when you're communicating a medical emergency to really be clear, concise, and think about what you see, what you hear, those types of things, to be able to communicate it. And then when you're building your team, think about your first responders. Who's going to be on your first responder team? If it's at a business, if it's at a place of worship, if it's at a community center. And I always tell people to think about a couple things. Who has who's been involved in medical emergencies before? Does anybody have any military training? Are there any EMS paramedics or EMTs or nurses? Who's had that training before? If you're in a school, is it the teachers? Is it the PE teacher? So somebody that's seen some type of medical emergency. If you're on a construction site, who's able to stay calm during an emergency? Who's seen blood before? Ask these questions when you're building a team. Are you afraid, do you faint at the sight of blood? Do you faint at, when you're getting your blood drawn? So really think about those things, and, think about your custodians in your buildings. So those people have easy access to the entire building, and they know the shortcuts to be able to get there. So it's real important to really utilize some of the people that you may not be thinking about. It may not be the supervisors, it may not be the executives. Those people may not respond during an emergency, a medical emergency. They're able to lead a team, but sometimes, those are the people that faint at the sight of blood. So be careful and have these open, honest conversations with each other. Who's going to respond? Who's going to get the AED? Do you feel comfortable, being with us during a medical emergency? Some people say yes, and some people say no, and it's okay to say no. That can be the person that can go out and meet the ambulance at the front of the building to get them to the victim as soon as possible. They can help escort the EMS services or police to get the person there as soon as possible. And then what type of training do you have for your first responders? What are some of the special circumstances? So, think about some of those things. If it's at a pool, you have to get that person out of the water. If it's at a park or lake, get them out of the water, dry their chest. You can still use an AED as long as they're out of the water and they have a dry chest. And then think about, some of the other special circumstances using an AED. Do they have a hairy chest? Are you going to need to shave it or cut the hair? You have to remove clothing. And we know that men are twice as likely to have CPR performed on them in public than women are. So it's so important to talk about that. You can start CPR through the clothing. When the AED gets there, you have to remove the clothing to put the pads on the chest. It has to have good adherence to the skin for it to work. And can you incorporate this with your fire safety training or your HR training during, the initial onboarding of a new employee, during new employee orientation? Can you do that? Can you talk about those things? This is what we do about a medical emergency. And when you think about a corporate culture, what better type of culture than you can have than thinking about your employees' safety and well-being, and really to give this life-saving training that they can take back out into the community and take back home to their family and loved ones and their friends, to be able to recognize, what you're doing for your employees, empowering them to help save a life. I think is really a bold statement as to the type of culture you have in your building, your place of business, or any place that you're at. What does it look like? When somebody suddenly collapses, there's two things that will throw you off. One is gasping respirations, somebody gasping for air, snorting or snoring. We'll breathe up to 3 minutes after our heart stops. There's enough oxygen in the brain to continue the respiratory drive. It's not normal respirations. It's gasping, it's snorting or snoring. So don't let that throw you off. And the other thing that will throw you off, especially in children and young adults, is seizure-like activity. So Hank Gathers, the basketball player that we had a picture of in the beginning, it looked like he was having a seizure. His arms and his legs would twitch and shake. We're not really sure if that's lack of oxygen to the brain, or it could be a lactic acid buildup in their muscles. So you get cramp or Charlie horse, you hold your leg stiff or you hold your arm stiff until it passes. Well, if you're unconscious in cardiac arrest, those muscles may contract and make it look like you're having a seizure. A sudden collapse is a cardiac arrest until proven otherwise. There's only one thing that will make somebody suddenly collapse, and that's a cardiac arrest. If somebody's fainting, they usually slump down because the body is trying to get blood up to their brain. So don't let a sudden collapse throw you off. It's a cardiac arrest until proven otherwise. And then it's really important to respond. So immediately respond, tap and shout, are you okay? Are you okay? Check for breathing, normal breathing. If it's not normal, or if you're not sure, start CPR right away. And then what type of equipment you have. So what type of AED do you have? So what's the specific brand? And I like to point out this pad system right here. You can see it's like a Z. So this, a lot of AEDs just have single pads that go on once, top right of the victim, low left of the victim on their chest. But this one has this pad system, and this area right here actually gives real-time feedback for CPR. But if you practice and get trained on these types of pads during an emergency, when you open this up, you see this and you've never seen it before, it's going to throw you off. It's going to delay you getting those pads in place. Where is your box alarmed? Do you have good signage to show where the AED is? Who's replacing the pads? And then what's in your first aid kit? Do you have scissors? Do you have a razor? Do you have gloves? Do you have wipes? So what's in your first aid kit that's attached to the AED? Very, very important to make sure that equipment is maintained and up to date and that you have it available in case of an emergency. That AED may sit on the wall for 8 years. You haven't used it in 8 years, but then that one day, that one moment in time, somebody collapses and you got to go get that AED. You want to make sure all this equipment is there. And remember, anybody can use an AED. You don't have to be trained on it. You just turn it on, turn the on and off switch on, and listen to the prompts. It's going to guide you through it. And then here's an example of a cardiac emergency response plan. These are some of the things to look for. So what's the building location information? What's the building name and address? Who's on the cardiac response team members? You can put those members. We recommend that you designate, if you're at an office building or school or someplace where you're in person, you may want to put some type of sign out on the side of the door. We don't want you to put a red cross or anything like that, just something that the internal people know what it means, that these people are on my first responder team. I can go to them and you can tell, you can tell a coworker, go to, Betty's office and get her. She's on the first responder team. I'm calling 911, go get her and activate the emergency response team. And then sudden cardiac events can vary greatly. We know that you have the faculty, staff, the team members have to be ready to perform. Immediate action is critical to successfully respond to a cardiac emergency and really any medical emergency. And then we want you to practice, assign tasks. Who's going to get the AED? Who's going to go meet the ambulance? Who's calling 911? Who's the responders coming to do CPR, and emphasize early CPR. The person who sees the person going into cardiac arrest or finds a victim on the floor, they can start with hands-only compressions as the first responders get there. They can remove the clothing, put the AED on, but really emphasize early CPR, because when you're pushing on the chest, the heart's pumping. When you stop, the heart stops. So it's so important. And then debrief afterwards. One of my favorite examples of doing an emergency practice drill is, we'll put a mannequin down somewhere, and then the first person that comes by, will say, hey, I need help in here. We have this person laying on the floor. I don't know what to do. What do you do? And that's usually, that's my favorite time, because that person will say, they'll put their hands up and say, I'm not on that team. And that's when I'll say, you are now. So what are you going to do? Who are you going to call? How are you going to activate your response? So, people work well when they have a task, when they know what to do beforehand. And then I tell people to bring an AED to every emergency. I'd rather you have it there and not need it, rather than send somebody back that needs it, when you need it. So I want to try to delay, take away any delays to get that first shock off. And then debrief, really make sure that you're debriefing and going over what went well, what can we improve upon, those types of things. I remember, doing a practice drill. It took 8 minutes for the AED to deliver the first shock. So we said, what went wrong? So when the person went to get the AED, the cabinet was real hard to open up when they tried to open it. And so they came back and they said, the cabinet's locked. And the team member said, no, the cabinet's not locked. You have to pull hard. So on all of their AEDs, because of that drill, they put a little sticker on there that says not locked, pull hard. So that's, they learn that though in a drill rather than learning that during a true emergency. So that's why it's so important to do a drill. We do fire drills at work. We do, those types of other drills, inclement weather drills. So those are really the things that I want you to be able to practice. If you can't do it in person, at least a tabletop practice drill. And it only takes about 10 to 15 minutes to do one of these drills. It doesn't involve the entire staff or the entire school or the entire team. It just really takes that core team and have them practice what they're doing. So basic life support, identify the emergency, call 911 or the internal first responders, early high quality CPR, make sure that the AEDs are publicly available, and then advanced care and post-arrest care. So these are some of the things that we need to really emphasize. It's basic, but it's very, very important, and it's very stressful during a true emergency. So, we want people to be able to respond that may not have any medical training. So that's why it's so important to get them comfortable, get this information out and be able to do this. I just want to show you a case study real quick. So this happened going on 7 years ago. So a 17-year-old female was playing volleyball. She went into cardiac arrest. Now I want to warn people, this is very graphic. It's a very graphic video that shows an actual cardiac arrest in real time as it's happening. So I just want to show this video, and then I'm going to talk to you a little bit about what happens after the video, what that timeline of when things happen. So you can see it really was a well-organized team. And this is the timeline as to what happened. Her dad gave us the video to let us use it as training purposes. So I really want to go through this timeline with you. So at 0 seconds, she grabbed her chest. 3 seconds, she hit the floor. So it was a sudden cardiac arrest. There wasn't any warning signs as far as when that was happening. There were some warning signs early on, some of that pain, syncope, some of those things that happened as we found out afterwards. At 16 seconds, a bystander tells someone to call 911. They didn't think a 17-year-old girl fainted. There was a cardiac arrest until proven otherwise. At 32 seconds, the AED arrives. And then at 56 seconds, CPR was started by a certified athletic trainer. Now that's almost a minute of recognizing a cardiac arrest and starting compressions from a trained medical professional. So that's what I'm talking about. When these things happen, it's really, is it really happening to me? So I think that's one of the important takeaways, is that we really want to emphasize early intervention because it's so important. The AED pads are put on at 1:43, a minute and 43 seconds. Defibrillation was delivered at 2 minutes and 11 seconds. So we got it delivered under that 3-minute timeline that we're really emphasizing trying to get to. And then CPR was discontinued at 3 minutes and 27 seconds. ROSC, I don't know if you saw that on the video, ROSC is return of spontaneous circulation. So her heart started to beat normally again at 3 minutes and 27 seconds. So that's how quick it happens. And then you saw the ambulance get there. And I think the timeline that ambulance got there was around 10 minutes. So she was, back awake, talking to people when by the time the ambulance got there, because they had that team in place that had practiced these drills and really emphasized it's a cardiac arrest until proven otherwise. And I think that's so important and such a big takeaway, how fast things happen. She went from playing volleyball into cardiac arrest to being defibrillated all within about a 5-minute timeline. So what are some of the cardiac impacts of COVID? We know that it's causing myocarditis, which is an inflammation of the heart. It could cause pericarditis, which is an inflammation of the heart sac. And then some of the cardiomyopathy diseases of the heart may lead to heart failure. So these are some of the things that we have to look out for long COVID. And it's so important to help, to be aware of these symptoms and really to follow up with your doctors, your primary care doctors, your cardiologists, get on that regimen, that plan of what, follow it to the best of your ability. But really, we want to prevent a cardiac arrest from happening. So important. So just in review, when seconds count, the public's role is crucial in saving a life. We know that we have to have you recognize it before medical personnel get there. We have to have you recognize it, start CPR, get the AED to really make a huge impact on saving somebody's life. You have to be prepared. You have to have training and willing to deliver it. There's a lot of people out there that are trained, but are they willing to get in there and start CPR? Are they looking for somebody else to do it? But if you do something, remember the only thing you can do wrong is not doing anything at all. So it's so important to do something. Whatever you do is going to help the victim. And then where's the AED? Can you get to it? Make sure you know where the AEDs are. You're all part of the AED family now. So when you're out traveling around, you have to find out where the AED is. I'm that person, when you're at a conference and they say, in case of bad weather, you need to exit here. In case of emergency, exit here. So I raised my hand at the American Nurses Association. So there's a room of 125, 150 nurses. I raised my hand and I asked the question to the lady at the podium, where's the nearest AED? And she, said, probably at the front desk. About 30 minutes later, we went to break. She came back and said, there's not an AED in this building. So we're going to have to do CPR for about 10 to 12 minutes because that's usually the normal response time of 911 getting to us. So we're going to have to do CPR for about 10 to 12 minutes before the AED gets there. And I always showed you what the survivability is as each minute passes. So you're going to be surprised where AEDs aren't that you think there should be. So, check at the grocery store, check at Target, check at any place you go, make sure at the community center, your church or place of worship, work, your schools, athletic leagues, all those things that I talked about earlier. And really, it's so important, time between onset arrest and the provision of care, that early CPR, early defibrillation. I know I'm saying that a lot, but I can't emphasize it enough. It's so important. So chain of survival, early recognition, don't let gasping respiration or seizure activity throw you off. Call 911. It's better to do CPR on somebody who doesn't need it than not do it on somebody who does. Early CPR, early defibrillation, effective and advanced care, and coordination of care in the hospitals. So make sure you're getting the victim to the right hospital, that one that has a cath lab that can do interventions, that can do, open heart surgery emergently. So those are the things that you really need to that chain of survival is so important. And then debriefing afterwards and making sure you follow up with the people to see how they're doing and how the responders are doing too. And then this is my contact information. If you have any questions, if you want to talk more about getting a plan in place for your facility, we're happy to help. My email address is here and also my cell phone number. People sometimes ask, well, how many people do you need to have a CPR class? My philosophy is if one person wants to learn CPR, I'll be more than happy to teach that one person, because that may be the person that needs to perform it in the coming weeks or months. So thank you again to the planning committee for allowing me to present this. Heart Safe Communities, anything I can do to help, anything Georgia Nurses Association can do to help to make sure you're prepared. And like I said, I hope and pray it never happens to you. But if it does, I want to make sure you give that victim the best chance of surviving. So thank you and have a good day.